Dear students, we will have a discussion about the case. Just look at the clinical finding. The clinical sign it is case with the sign. What is ulcer edge look like? Very typical. You know that ulcer has got edge, margin, floor, base, surrounding area. If this is the ulcer, this is the floor, this is the base where it treads, this is the margin, this is the entire thing is the edge. So this is the surrounding area. So edge of the ulcer, what is this edge looks like? See that? This is the ulcer, this is the surrounding area, this is the margin, this is the edge. Edge is undermined like this. Undermined edge. So this is typical undermined edge. Mostly tuberculosis is the cause, but here in the bed sore also sometimes it will become. But a sore is usually punched out edge. Don't get confused. Bed sore punched out at your level. And undermined tuberculosis. So causes for tuberculosis, lymph node. Through the lymph node ulcer can occur. Spine tuberculosis, especially T10 vertebra, the spine is commonly involved by tuberculosis. Spine tuberculosis can cause cold abs and Undermined ulcer. And pulmonary tuberculosis can cause eventually ulcer somewhere else in the skin or to the lymph node. So different tuberculosis primary focus can cause ulcer eventually. Tuberculous lymphadenopathy is circulating type common in the neck which ruptures and forms an ulcer. So ulcer can occur. So undermined is typical of the tuberculosis. Remember, puncture out is typical of the trophic ulcer or bed sore. So primary site elsewhere should be looked for like spine, hip, lymph node. Discharge study for the AFB, wedge biopsy from the edge. It shows epithelioid cells and caseating necrosis and tubercles. And MRI spine to find out the focus or pelvis. And chest X-ray to the primary focus, ESR, blood smear, hematocrit. Treatment is anti-tubercle drugs and ulcer management and treatment for focus. Focus, where is the focus should be treated? This is spine. Spine should be treated by the spine surgeon. Sometimes requires a fixation, sometimes it requires a external fixation, or sometimes it requires a surgery. So not posterior, anterolateral approach, because posterior lamina has to be retained because vertebra will be collapsed. So anterolateral approach you should have in tuberculosis spine, not posterior approach. This is the point you have to remember. Punched out is trophic ulcer. Raised and everted is SCC, squamous cell carcinoma. Beaded is BCC, basal cell carcinoma. Sloping ulcer is healing ulcer. Sloping edge is healing ulcer. Undermined is tuberculosis. Trophic, punched out or bed sore is a common example. Raised and everted is squamous cell carcinoma or epithelioma. Carcinomatous ulcer. Raised beaded is rodent ulcer or BCC. Undermined tuberculosis. Sloping edge is healing ulcer. So edge in rodent ulcer is, find out the right answer. I'll get back to you. I acknowledge your answer. Postoperative progressive bacterial synergistic gangrene is called as ABCD. Again, find out the right answer. I will get back to you. The people are being hated when they are real and are being loved when they are fake. That is what exactly in world it happens. So we should be very, very careful. So students, please go through my SRB manual of surgery. It gives a detail about all CBMA syllabus and covers both for MBBS and postgraduate also. But we got MCQ for each topic wise. General surgery, gastroenterology surgery, urology, specialty basic urology, neurosurgery, cardiothoracic. All those basics are covered. Instruments, adjuvant therapy, chemotherapy, briefly about anesthesia, specimens, briefly about anesthesia, briefly operative surgery, and current recent advances also. Everything covered with the quotations, with the illustrations, with the photos. Everything is covered. More than sufficient for undergraduate. So go through this book, learn surgery and face exam, face MCQs, everything for both UGs and postgraduate. Also go through my clinical methods in surgery with the video of how to examine each topic. It gives a detailed examination method, but of course there is no management in this. It is a clinical book and briefly in a tabular form, differential diagnosis and good photos and exact out examine and out write case sheet of each different topic, ulcer, swelling, breast lump and everything covered. Briefly orthopedic also. It also has got specimens, images, instruments which can always be useful when you take Viva and Oxy and practical exam. So very, very useful because we have all videos of how to examine a patient. It's very, very important. in your practical exam of any medical graduate of any type. It will be very, very useful. So please go through it and have it. And my operative surgery, the 2-volume book, new edition has come, and it was extensive discussion about the methodology, technical principles, and steps of the different officers, major to minor. Everything is covered with around 10,000 illustrations and photos. And my tissue atlas of tissue approximation, small 100 pages book with the video, how to do suturing in different situations properly with the video. That's shown very well, and can always go through that. And my DigiNow lectures through JP Publishers, around 220 hours, covers everything, A to Z topic, virology, specimens, instruments, clinical examination, videos, everything it is covered. Please, you can purchase for a year so that you will have the clear idea. You can weigh the exam, have the clear idea, academic part, everything. You will have an entire subject is covered, including clinical part. So please purchase and have a clear idea about subject and face the exam. Student, I hope you understood my this subject very well. Thank you so much.